The healthcare system is still mostly based on a fee-for-service model. How does it work? What does it mean for patients? What can you do to use it to your best advantage? Welcome. I am your medical bill whisperer, a previous billing manager turned patient advocate. I am committed to bringing answers, insights, and solutions to patients like you. Many agree the healthcare system is kind of a nightmarish maze, but it's basically run on two payment models. One is fee-for-service, explored in this video, the payment model called value-based care. Fee-for-service is simple. It means one service rendered by a medical provider is paid by your insurance company with one fee. Every visit, intervention, supply, drug, item, procedure, report, test, scan equals one fee, one payment. Medical providers price each service according to their own criteria and bill insurances for you for payment. Insurance companies will calculate a fee schedule that assigns a monetary value to each service. That is called an allowance, whether the provider is contracted with a plan or not. Insurance companies then pay the medical providers based on that fee schedule, billed amounts, contract status, applicable state or federal laws, and terms of your own policy. Basically, the more services, the higher a medical provider gets paid. And of course, the higher your cost. The value of medical care is reflected by the number of services, whether diagnostic or therapeutic. The price of medical care is determined by the number of those services. The incentive of income for medical providers is based on the number of services. Clinical decision-making is supported and justified by the number of services. Last but not least, focus is on intervention, not on prevention. Quantity has become equivalent to knowledge, but not quality. And contributing factors lead medical providers to continue ordering many, if not too many, services. One is the fear of malpractice that leads to defensive medicine and the elimination of any risk, however remote, by ordering every possible service to rule out in order to diagnose a medical condition. Standard of care, and I welcome you watching a special video on that, has been leading to conventional medicine. This means using every tool at every cost and mostly aggressive interventions. Insurance requirements for authorizations and coverage has led to a high number of services to justify an intervention or rule out more benign diagnosis and therefore costly therapy or treatment. Problem is, more services are rendered to you, whether you truly need them or not, is that you will pay more. Quantity does not mean quality. Services do not mean better care or do not translate into better outcomes. The US is one of the unhealthiest population among developed countries. And despite spending the most per capita, Americans' life expectancy is much lower, while costs keep on skyrocketing from year to year. Low focus on preventive care is an issue. Medical providers get paid very little for this type of service. It requires fewer interventions or visits and therefore translates into little income, can only be offset by a very large number of such patients. As more than half of all medical practices in the US are now owned by large hospitals or entities, providers are encouraged, if not obligated, to comply and follow medical policies and standards of care dictated by their employers and upper management that may or may not be in the medical field at all. And some medical practices that invest in expensive equipment or advanced technology have the financial incentive to use it and therefore get paid for it, even if less costly options for diagnostic or therapeutic reasons are available. Now, is there hope? Well, yes, there is. But first, remember to always seek medical care when urgent or necessary, and that only you and your doctors are the best judges for the need and extent of that care. But asking questions to better understand why something is necessary, or asking whether a more affordable option is available, or maybe a less aggressive option, that is not undermining your doctor's medical decision, nor judging their professional standing. Any good doctor will be ready to clarify a decision and help defer high costs whenever possible. I would also always use an in-network provider whenever possible. There are federal and some state laws that protect patients from higher costs under emergency conditions or for certain out-of-network services. But most medical care is prescribed or elective. Your insurance website can help you locate an in-network option in your area, and that will save you money. The best hope comes from a switch being implemented at a national level. It's a switch to a value-based care system. This model comes in different shades, but the overall principle is that medical providers get paid or get a bonus for better outcomes and when using less services. So better care means more money, not more services. The other good news is that CMS, the Center for Medicare and Medicaid Services, is leading the way and has already been implementing such a system for part of their members. The financial and legislative weight that CMS brings is the catalyst for new programs that medical providers get used to following. And as no one knows how to save money and better manage premiums and costs than CMS, the regulations and protocols they implement usually end up being followed by commercial insurance companies. Hope is that your health will be managed better at a lower cost, both to your insurance company and to you in the very near future. Now, there are limitations, there are loopholes that need to be ironed out. However, the spread of value-based care can no longer be ignored. You may not be able to change the payment system that your plan or your insurance company operate under, but remember, you can always work with your medical provider to use resources more responsively and therefore contain cost whenever safe and possible. I so thank you for watching. Your likes, comments, subscribes help this channel grow, reach out to many more patients. Thank you.